Hello, my name is Hallie, and welcome to this assessment of psychological disorders. And holy moly, are there a lot of disorders that could be tested on the MCAT, but that's okay because all of this information is going to be relevant to our clinical careers, and for that reason will be a pretty interesting review. If you took a psych class before 2013, do note that we will be following the DSM-5 classification of psychological disorders, so some of these may sound familiar, but their names might have changed when the DSM-5 came out. And by completing this review, we'll have a better understanding of the types of psychological disorders that can be presented on the MCAT, and we'll be able to evaluate questions such as the one at the bottom of the screen that asks us to identify the key characteristics that are common between two related disorders. Let's begin with one of the more well-known psychological disorders, which is schizophrenia, and this is our prototype for psychotic disorders. Schizophrenia literally means to split the mind, but don't confuse this with split personality disorders or dissociative disorders. It was simply named this way to signify that the mind had split from reality. And schizophrenia has two types of symptom classes, one being positive. Now, positive doesn't mean good here. They called these positive symptoms because if you look at a patient as a mathematical equation, these are the types of behaviors you would have to add on to a normal person for them to be schizophrenic. And the negative symptoms are the behaviors you would have to remove from a normal person in order to create a patient with schizophrenia disorder. Before we dive into the symptomology that's associated with psychological disorders, do note that none of these are a checklist. You don't have to have every single symptom presented in order to be diagnosed with these disorders. The positive symptoms of schizophrenia fall into four main categories. The first being delusions, and delusions can present in a few different ways, but basically it's a distorted version of reality. For example, you may have a patient who watches a TV show and they begin to believe that the characters on those TV shows are talking to them. They're having a conversation. There's also people who hallucinate. This usually presents as auditory hallucinations, but you can also see visual and sensory hallucinations as well. The third is disorganized thought, and these patients will either change subjects so quickly that it's hard for the listener to understand their train of thought, or they'll have unusual associations with the words that they use. For example, a patient who is presenting with word salad may say a sentence like, "I felt yellow and today my goat." The fourth positive symptom is disorganized behavior. Just an inability to carry out daily activities like paying your bills on time, keeping your appointments, keeping up with your hygiene. The negative symptoms of schizophrenia fall into two categories. The first is disturbance of affect, which is a distortion of their ability to express emotion. For example, you may be telling this really sad story about a patient that's struggling with their life, fighting to see their children grow up, and a schizophrenic person may find that to be hilarious. The second is avolition, where they lose sense of their goal setting. So these patients may bounce around from job to job or lose a lot of their personal and romantic relationships because they simply don't have the same set of goals that the average person would have. One caveat to note about schizophrenia and its treatment method is that most of the medications developed for schizophrenia were developed to address the positive symptoms and not the negative. Let's assess major depressive disorder. And this is not the same as I have a little bit of the blues because my team didn't do so well yesterday. This is major severe episodic depression that is disproportionate to the stimuli that triggered it, and it's maladaptive with your daily functions. We have a nice mnemonic for the symptoms associated with this disorder, which we call SIGI-CAPS, which refers to changes in sleep, loss of interest, excessive guilt, decreased energy and concentration, changes in appetite, psychomotor symptoms, which refers to feeling slowed down in response to their depression, and also potential suicidal thoughts. For people that struggle with periods of depression but don't quite meet the qualifications to be considered major depressive disorder, fall into persistent depressive disorder, which is not as severe but is longer in duration. Another major depressive disorder is seasonal affective disorder, which is very aptly named because it can be abbreviated as SAD, which many of us might be familiar with. We associate it as having an onset during the winter months, and it has to do with the amount of direct sunlight we get during the winter. And the underlying cause is associated with the way melatonin is metabolized when we have decreased exposure to sunlight. And the best way to treat SAD is by having the patient sit under bright lights, which are sometimes called happy lamps. Let's now assess the bipolar disorders, which at one time were called the manic depressive disorders. And these are characterized by people who will go through episodes of mania where they feel very happy, very full of life, but the sense of euphoria is destructive and is pathological in nature. And then they slip into bouts of depression where they're not so excited about life and it's a slow onset, but the depressive episode lasts a bit longer, and then overnight it feels that they come right back to that episode of mania. And these patients will cycle between these two episodes on and on and on and on and on. The manic episodes have some key symptoms, which we refer to as dig fast. And dig fast refers to that these patients are distracted, they don't need a lot of sleep, grandiose ideas where they feel like the world is their oyster and they can conquer it. Flight of ideas, lots of new ideas that they want to accomplish, but they get a little annoyed when you want to slow them down. Also pressured speech, which is the ability to talk as if everything is an emergency, even though everyone around you doesn't seem to think it is an emergency. And then finally, thoughtlessness. And thoughtlessness is referring to an increase in impulsivity where they may act on a thought without really considering the consequences of their behavior. The symptoms that we have assessed so far are characteristics of classic bipolar I disorder. However, there are other types of bipolar and manic disorders, one being bipolar II. In bipolar II is thought of as having less extreme bouts of mania, but they have at least one episode of major depressive disorder. So the depressive episodes are a little more severe in bipolar II, while in bipolar I, the manic episodes are a little bit more severe, but they don't necessarily have to have major depressive episodes. There's also hypomania, hypo referring to less, and these patients do still have manic episodes, but it's not so extreme that they can't function normally. They just have periods where they're in a really good mood. Then there's also psychothymic disorder. These are patients who still cycle between mania and depression, but it's not so severe that it warrants the title of bipolar. Next up, we have the anxiety disorders. And DSM-5 lists that there are at least 10 types of anxiety disorders, all of which are characterized as a disproportionate and severe form of worrying about things that most people encounter in everyday life. And it does have a duration of at least 6 months. Generally, anxiety disorders have some form of trigger, but it is hard to maintain normal functioning once that anxiety is triggered. There are a few specific anxiety disorders that we'll want to know for test day. The first being general anxiety disorder, and this is characterized by people who have a disproportionate amount of anxiety towards everyday tasks that most of us manage with very little stress. And I think all of us have probably met a person who would fit this description at some point in our life. These are people who just go about life acting like the sky is falling and that there's always some form of an emergency, even though it may be common everyday things like making your mortgage payments. There's also specific phobias. This is the most common type of anxiety disorders, and it's triggered by a specific fear. And for some people, that irrational fear may be spiders. The next example is social anxiety disorder. And this is a class of people who are very anxious about social interactions because they have an overwhelming fear of being embarrassed. Agoraphobia is characterized as people who are terrified of being in public because they feel that if some accident were to occur, they wouldn't be able to escape and protect themselves. But these people feel very safe in their homes and often entrench themselves. Lastly, there's panic disorder, which is characterized by panic attacks. And it's characterized by having this overwhelming sense of impending doom, and they have symptoms that you would associate with the flight or fight response of the sympathetic nervous system. Another anxiety-driven condition is obsessive-compulsive disorder, which is often referred to as OCD. These are characterized as having a persistent irrational thought that the person will obsess over, and it's usually severe enough to impede their daily life. And in obsessive-compulsive disorder, there are usually two key characteristics. One is the obsessions. These are the thoughts or anxieties that the person will obsess over that will raise their stress levels. And the other being the compulsions, or the behaviors that the person will use to remedy or lower their stress. For example, a person that obsesses over germophobia, where they feel like there's bacteria all over their skin, will obsess or stress over that thought, and then will compulsively wash their hands in order to lower the stress of their obsession. Another type of OCD is body dysmorphic disorder, and this is characterized by people who obsess over one particular body feature. This may be their nose or their lips, and they feel that it's so horrific that they'll go to extreme lengths to alter or, in their eyes, fix what's wrong with them. Well, we've arrived at the dissociative disorders, and these are characterized as disorders that help the patient to avoid stressors in their life by escaping from reality or their identity. There are three types of dissociative disorders. The first being dissociative amnesia, and this is very well named because if a patient witnesses something like their loved one dying, they may block out that memory and choose not to relive it. There's also dissociative identity disorder. This is when a patient develops multiple personalities in order to help them to cope with a stressful event. If you've ever heard of the TV movie called Sybil, that's a great example of dissociative identity disorder, and this used to be called multiple personality disorder. There's also depersonalization or derealization disorder. These are people who just are detached from reality. They're very automated. They just don't really seem to be living in this world. Moving on to the somatic symptom disorders, and these are characterized as patients who have a chief complaint about some sort of bodily injury or condition that may or may not be related to an actual medical condition. And there are three types of somatic symptom disorders, the first being somatic symptom disorder, and this is when a patient presents with a chief medical complaint that may be related to an underlying medical condition, but the complaint seems to be disproportionate to the underlying condition. Prior to the release of DSM-5, patients with illness anxiety disorder would have been called hypochondriacs, and this is where patients feel that they're at risk for contracting some sort of disease, and they're constantly checking themselves for symptoms of this ailment, even though they're not really at risk for actually getting the disease. And then finally, there's conversion disorder, and this is when patients have some sort of motor or sensory response to a stressful event that doesn't seem to be caused by an underlying neurological problem. For example, if a patient witnesses something really stressful, like someone dying or a horrible accident, they may have what's called hysterical blindness, where they lose their sight for a period of time, but there isn't a neurological reason as to why they lost their sight. It's associated with the stress. And we've finally arrived to the last item on this agenda, which are the personality disorders. And these are characterized as behaviors that are associated with certain types of personalities that are so extreme that they're maladaptive. And this disorder is considered egosyntonic. Egosyntonic meaning that people that present with these types of disorders don't really see an issue with their behavior. They may recognize that it's not normal or it's not common, but they don't see a problem, and they just like things the way they are. Whereas other disorders that we've identified previously in this review would have been considered ego-dystonic, where the patient realizes, yes, my behavior is abnormal, yes, it's bothersome and intrusive, and dys refers to this isn't really part of their true personality. These symptoms have been thrust upon them, and it's intrusive in their daily life. The personality disorders have been clustered into three categories: A, B, and C. And for test A, we've developed a mnemonic that will help you remember which personality disorder belongs to which cluster. Cluster A tends to be the weirder personalities, while cluster B tends to be a little more wild, a little more impulsive. Cluster C tends to be a little more worried or anxious. And as A, B, and C are alphabetical, so is weird, wild, and worried. There are three types of personality disorders in cluster A that we will want to know for our MCAT. These are characterized as just being a little odd or eccentric. There's the paranoid personality disorder, which is very aptly named because they have an intense mistrust of other people. The schizotypal are very magical in thinking. They tend to believe in superstitions and clairvoyance. And then there's the schizoid. These people struggle to maintain their interpersonal relationships because they don't really have a desire for social interaction. They're kind of happy on their own. There are four personality disorders that we'll want to know from cluster B, the wild cluster. These are characterized as being dramatic, emotional, or erratic. Antisocial personality disorder has a complete disregard for the rights of other people. If you've ever seen a TV crime show, the writers usually mirror the personality of the bad guy or the serial killer after antisocial personality disorder. There's also borderline personality disorder, and these are patients who have an intense fear of abandonment, and for that reason, their mood, identity, and relationships are unstable because they're expecting everyone to disappoint them. Histrionic personality disorder is essentially extreme attention seeking. These personalities tend to be very emotional, they like to be the center of attention, and they like to have the world be catered around them. Whereas a narcissistic personality disorder may appear very lavish and proud of themselves, but it's because they have a crippling insecurity and they're trying to prove their worth to people all the time, and so they come off narcissistic. And finally, there are 3 personality disorders that we'll want to know from Cluster C, the worried group. And these personalities tend to be anxious or fearful. There's the avoidant personality type, which has an extreme fear of rejection. And for this reason, they tend to keep all of their relationships and jobs for life because they don't like starting over and putting themselves back out on the market and trying to start over. There's the dependent personality disorder, which has a constant need for reassurance. They tend to put all of their dependency on one person, whether it's a family member or a spouse, and then they depend on that person to make all of their decisions and be responsible for their actions. It's also obsessive compulsive personality disorder. These patients are obsessed with perfectionism. They like rules and they very much despise change. This is a great example of an egocentric personality disorder because patients with obsessive compulsive personality disorder don't feel that there's anything wrong with their behavior. They just like the world to work a certain way and they don't see it as a problem. However, obsessive compulsive disorder, which we assessed earlier, is ego dystonic. OCD patients tend to know that their behaviors are unusual or inconvenient, but they can't help it. They still have this need to clean their hands all the time or whatever their obsession may be. And by completing this review, we can now analyze a series of symptoms and identify the term that best represents that symptom, such as the scenario presented in this question. And the correct answer is compulsion. Remember that obsession are the thoughts that increases a person's stress level, while the compulsion is the behaviors that people will undergo in order to relieve that stress. We can also use the information from this review to identify statements that would be true for 2 different disorders, such as this question. And the correct answer is D. Body dysmorphic disorder was purely about body image, while patients with somatic symptom disorders present with an actual symptom. We can also evaluate why certain disorders are clustered together into categories, such as this question. And the correct answer is B. This is because dissociative disorders are associated with traumatic events, and the patient responds to the event by removing themselves from reality. We can also identify a disorder that most likely applies to a patient by reviewing their behavior, such as this question. And the correct answer is borderline personality disorder. Remember, these patients put an intense dependency on the people that they care about, and so they view the people in the world as being entirely good or entirely bad. So quick highlight of what we really do want to remember for test day is that schizophrenia is a prototype psychotic disorder characterized by delusions and hallucinations. We use the mnemonic SIGI to remind us of the symptoms of depression, while DIGFAST reminds us of the symptoms of bipolar. Remember that bipolar is an intense switching between manic and depressive episodes. Anxiety disorders are characterized as worrying about many different things, while OCD is characterized as being obsessed with some thought and then using compulsions or behaviors to relieve the stress associated with the thought. Dissociative disorders are patients' way of removing themselves from reality following a stressful event. Somatic symptom disorders are bodily conditions that don't appear to have an underlying cause, and personality disorders are egocentric, maladaptive behaviors that are intrusive on the patient's life. Well, congratulations on completing this review. That was no easy task, and for that reason, I'm going to keep my sign-off short and sweet. Thank you for joining me, and best of luck on your exam.